Skin health goes beyond cosmetics and anti-aging treatments. With more than 3,000 unique skin conditions affecting people of every age, background, and ethnicity, it matters who you go to for help. Dr. David Malakouti, board-certified dermatologist and medical director with Frontier Dermatology, is here to share more. Thank you so much for being here.
Thanks, Kelly. I am thrilled to be here today to talk a little bit about the world of dermatology and what that entails. As you mentioned, there's a lot of skin conditions to talk about. Dermatologists are expert in the skin, the hair, the nails. There's over 3,000 unique dermatological conditions, so there's a lot we have to get through today, actually. I hope everybody brought their notepads.
And tell everyone, too, about Frontier Dermatology and how you guys help.
So Frontier Dermatology is the largest dermatology group in the Pacific Northwest. We have over 40 locations, 120 providers, so there's a good chance that we have a location in your backyard.
And talk to me about biopsies, because you hear a lot about this when you're going in to get your skin checked.
Absolutely. So when a patient comes into our office, they're going to see some of these equipments that we have here on the desk. The most indispensable tool for a dermatologist are these two devices called dermatoscopes. Now, these function exactly the same, but they're made by different manufacturers, and they are able to allow us to look at a high level of magnification, 10 times magnification, allows us to look at the individual cells and how they're organizing, and to help us determine if we need to make a biopsy or not. The larger device is a similar functioning device. It doesn't have as high magnification, but it has special UV filters that allows us to make diagnosis for autoimmune conditions and certain infections.
This is so interesting, but what do you do if a growth is cancerous? It's not the word you want to hear.
Yeah, that's a good question. So a biopsy. A biopsy is when we sample the skin and we have it reviewed by one of our board-certified dermatopathologists. And based off the structure of these atypical cells, they're able to render a diagnosis of possibly skin cancer. Fortunately, the overwhelming majority of skin cancers have an excellent cure rate of 95 to 99%.
Wow, good. So you just need to get in early and get checked.
Exactly right. Exactly right.
And you also offer non-surgical options, which I feel like is important to note.
Correct. We have a state-of-the-art, non-invasive treatment for skin cancers called image-guided superficial radiation therapy, which is a mouthful. IG-SRT for short.
Okay, that's better.
Yeah, so IG-SRT, we use a high-resolution ultrasound to measure the depth of the cancer, and based off that characteristic, we're able to deliver the appropriate amount of superficial X-ray therapy in order to achieve a 99% cure rate for many cancers.
I love hearing these cure rates. Getting our moles checked, so important. We've talked about that. What should we be looking for ourselves?
Yeah, there's many different characteristics of cancers, but the most concerning ones are related to the ABCs of melanoma. So, Kelly, do you remember your A?
I do. I think asymmetry.
That's correct. A stands for asymmetry. That means if you draw a line down the middle, it should look the same on both sides. If it is different, then that does warrant extra evaluation. B is for borders. Moles are typically smooth and well circumscribed, but if you see scallop borders, if you see irregular projections coming out of your moles, we should take a look at that. C stands for color. Generally, moles are uniform in color, or maybe different shades of the same color. But if you're seeing a dark area and a light area and a white area, that would certainly be concerning. D stands for diameter, and that is about the size of a pencil head eraser, 6 millimeters. So moles larger than 6 millimeters should be evaluated. And the most important one is E for evolving, and that's when a mole is changing over a short period of time, even if it is changing from a normal looking mole to another normal looking mole.
So much to think about, but it makes it easy with the ABCDE that we just saw. You also brought some other things here, so I want to talk about reducing our risk. How do we, do all of that with the summer? Yeah,
these are some of my favorite best-selling sunscreens that are available at most stores. The most important things that you can do are your typical sun protective practices, like wearing sunscreen, you wearing UPF level clothing, and avoiding sun exposure during those peak hours. In the Northwest around this time, that's about 10 to 4 p.m. Yep.
Okay. What do you like about these products too?
So when you go to the store and you're looking for a brand of sunscreen to pick out for yourself, there's a few things I'd like for you to look for. One would be the SPF level. It should be at least an SPF of 30 or greater. It should say broad spectrum on the bottle. Broad spectrum means that the manufacturer has included a number of overlapping UV filters to give continuous coverage from the UV spectrum. You also want it to have some level of water resistance if you're going to be active, like if you're going to be going to the swimming pool or to the lake. You don't want that to wash right off. Now, all of these sunscreens have different functions. Some are more elegant to wear, some are tinted. That will allow you to maybe do some makeup over it if you need to, or you don't want to look really shiny and greasy when you're out and about town. And then others are really, really thick, like for your kids. I don't think they need to impress anyone so much.
No, and honestly, I don't either. As long as it's protecting me, I'm good with it. You are amazing. This was so insightful. Thank you for being here. And if you have a funny looking mole or a question about your skin, it is so important to get that checked out. Just head over to frontierdermatology.com and find a provider near you.
New Day Northwest is sponsored by Frontier Dermatology.